Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to go over the topic, do nurses eat their young? Now, if you're a nursing student or a nurse, at some point you have heard the phrase, nurses eat their young. Whenever I was a student, this was the first time I heard of it. And before we were starting clinical, some friends had said, I heard that nurses eat their young, and I had no idea what that meant. So in this video, I want to talk to you about the following things. I'm going to explain the meaning of it. I'm going to talk to you about my experience with this, why it tends to happen, and what to do if it happens to you. So let's get started. First, let's talk about the meaning. What does it exactly mean when someone says the phrase, nurses eat their own young? This phrase originated from some nursing students or nurses who have been treated with disrespect. Maybe they felt like a nuisance to a nurse who maybe was orienting them, or they had experienced some type of aggressive behavior from a more experienced nurse. And apparently nursing has really got this negative perception to it. But you have to remember, this type of thing not only happens in the nursing field, but it happens in other professions. So say you were getting a degree to become an accountant and you get hired on, you're the new accountant. Sometimes more experienced people try to make the new people feel like they have to earn their way because they had to earn their way. So you may encounter some aggressive behavior in that. But overall, whenever I was a student and a nurse and a new nurse, I really didn't experience this as much as people who have maybe graduated like 5 to 10 years later than me. So it has in the past really been a problem with some people. And I think nowadays, especially with the newer generation of nurses coming up, the culture of nursing is changing, especially with the millennials, because as a nurse, I've seen new grads who are really open to the idea of having students with them. They love it. They love sharing the knowledge. They love teaching them because they remember how stressful it was and how hard it was to be a nurse. But overall, you can encounter this, but generally it's not as prevalent, I think, as it used to be. So let me talk to you about my experience with it, because I have had some experiences with this and I have to just share the story. So whenever I first was thinking about doing this video and thinking about this topic, this was my first experience that I wanted to share with you guys that came to my head, came to my memory. I remember being a student. I was in my OB orientation, and I was on the postpartum unit, and I was at the nurse's station looking through a chart on a patient, and there was no one else in the nurse's station except for a doctor over across from me looking at a chart as well, and there was a lot of empty seats, and I was sitting down reading my chart, and then all of a sudden I hear someone stomp their feet and put their hand on their hip and go, ugh, like that. And well, I looked up, and there's this nurse standing over me. And I was like, am I in your seat? And she was like, yes, you're in my seat. So I picked up my chart and I got up and went somewhere else and sat down. And she plopped down in the chair and sat down. And I looked across over at the doctor who was observing this situation unfold. And he rolled his eyes and was realizing how ridiculous it was. And the fact was that there was all these other seats she could have sat in, but apparently that was her assigned seat. So that is a little taste of what nurses eat their young means. And that was one of my experiences that I had. Now, let's talk about some other examples that you might experience as a student. I've seen where students, and I did experience this on some floors, like during your clinicals, you may go to a floor and the nurses on the floor really just ignore the students. They don't talk to them. They don't really go out of their way to show them anything. And if they do, it seems like it's a big chore and a big task. And that makes you feel unwanted. And then as new nurses, I've seen where other coworkers have been sort of rude to the new nurse if they're asking a question that everyone should know and the new nurse didn't know it, or not seeing support for that nurse whenever they may need help because they're sinking in their patient load. And I've seen instances with that. Now, why does this happen? Why do nurses sometimes tend to treat the students or the new nurses not very well. Well, I tend to think why it happens is that one reason is that they are just really tired themselves and overworked. Maybe they're on their fourth 12-hour shift and they literally, all they have energy to do is take care of their patients. They don't have time to teach a student or just take that extra time to do that. Or maybe they forgot how it was to be a student or a new nurse themselves, because after 5-6 years, those memories seem to fade, and maybe they forgot how hard it was and how it's really, you just need help and you need someone to teach you. And last but not least, a lot of times maybe that person had it done to them as a new nurse or a nursing student. So they're just like, well, I had it rough. People didn't teach me. I had to learn the ropes myself, so they're just going to have to do it themselves. So that might be a reason why this happens sometimes. Now, what if you're experiencing this right now? What to do if this happens to you? Well, there's 3 steps that I think you can do. First, you want to do the most non-invasive one. You just want to, if this is an isolated event that happens like during clinicals or as a new nurse, try to just shrug it off and try to just think of, well, maybe this person is going through a difficult time right now. Maybe they have some major family issues on. Maybe they're just under a lot of stress, and maybe that's why they snapped at me. Because I remember one time I had a coworker whenever I was a new nurse, and they were just on edge all the time. And it turns out the reason that they was because they had some major family issues going on. So I'm glad I didn't approach the issue or anything like that, because that could have just really set them off. Okay, number 2, say that this just keeps happening over and over and it's not an isolated event. The best thing you should do is approach that person and do it tactfully and just explain, I noticed that I've seen this behavior. Is there something I've done to offend you? How can we work better together? I want us to work together because, this is teamwork. If that doesn't work, say that made it worse. Always go to like your manager or beyond to get like some advice or report this from happening. Because as a nurse or a new nurse or a student, you are not subjected just because you're new to harassment of any kind. So you always need to take care of it and get the support you need. So that is a little bit on the phrase, nurses eat their young. I hope I explained that. And just in conclusion, it's not as bad as people really make it out to be. I had some random instances with it, and you probably will too. But if it does happen to you, just try to follow those steps. Nursing is really a great profession. And, whenever you become a nurse, just remember how you should treat other nursing students and other nurses. And you can lay the foundation of saying, hey, I want to help others and I'm going to mentor them and welcome them into this, because we need new influxes of nurses coming in and learning the ropes, because one day we're going to retire and they're going to be taking care of us, and we want to make sure that we have good nurses. So thank you so much for watching this video, and please subscribe to my YouTube channel.